We still take pride in the fact that Europe has one of the best food safety systems in the world.
E é uma segurança muito grande, porque se me acontecer alguma coisa, eu penso sempre que tenho todas as possibilidades, ninguém me vai impedir de ser tratada, seja em algum hospital, em algum centro de saúde público, e por isso eu tenho, acho que recomendo a toda a Europa que o tenham também.
One of the most important concerns for people is their health, but out of all of its portfolios, the EU really has its hands tied when it comes to healthcare because it's considered such a national competence. According to the Lisbon Treaty, there is no legal framework for the EU to adopt a general European law in the field of healthcare. Member states are responsible for the organisation, management, financing and delivery of their own healthcare. So what role can and has the EU played to improve public health in Europe? Its 2008-2013 health programme aimed to provide a benchmark for common healthcare standards across the Union and narrow the gap between different practices in the member states through closer cooperation and a better exchange of experiences, information and knowledge. A comprehensive health information system is being developed to provide EU-wide access to reliable and up-to-date information on health-related topics. In particular, the European Parliament has been working on improving the diagnosis of rare diseases and has put in place a system where a specialist in another country can use his or her expertise to help confirm the diagnosis and allow the patient to be treated by that expert in another member state. To give his thoughts on the EU's role in healthcare is Dr. Bertolini, Chief Scientist at the World Health Organization and its representative to the EU. Dr. Bertolini, what for you has been the EU's greatest achievement in health in the last 5 years?
I think one of the most important achievements is the approval of the Cross-Border Health Directive, which is actually making a big difference in the way in which the countries are actually handling the emergencies which might arise because of the introduction of the new viruses in the European area, because of the purchase of vaccines and medicaments and the coordination among the countries, the emergency committee. So it's something which builds up a sort of more coordinated mechanism among the member states on a specific issue.
Indeed, thanks to EU legislation, if you are travelling in another EU country, you can obtain medical treatment easily. With the European Health Insurance Card, you are entitled to receive the same treatment at the same price as any other insured local from that country. And you can be reimbursed when you get home. The Cross-Border Health Directive was updated in 2011 under the careful guidance of EPP Group member Françoise Grossetête. Now, access to healthcare abroad is not just limited to emergency treatment.
C'est une directive qui permet aux citoyens européens de pouvoir bénéficier de soins de santé programmés, et non pas de soins de santé d'urgence, mais programmés dans un autre État membre que son État membre d'origine. Je vous donne un exemple, j'ai besoin de me faire opérer, de me faire mettre une prothèse de hanche par exemple, et dans mon pays on me demande 6 mois de délai, or je souffre beaucoup, j'ai du mal à me déplacer, je ne veux pas perdre 6 mois à souffrir, je demande à pouvoir me faire soigner dans un pays voisin parce que là j'aurai moins de délai d'attente. Est-ce que j'ai le droit de me faire soigner dans ce pays? Est-ce que je dois bénéficier d'une autorisation préalable? Est-ce que je serai remboursé? Dois-je faire l'avance des frais avant d'être remboursé? Ce sont toutes ces questions qui sont des questions importantes pour le citoyen. Et cette directive, elle répond à ces questions-là.
Under the new directive, member states are required to establish national contact points to provide patients with information about their rights and the practicalities of receiving cross-border healthcare so they can make an informed decision. However, the directive is not without its critics, who argue this places an unnecessary burden on healthcare immigration, where member states fear they will be unable to care for their own citizens, let alone those of other countries. But Madame Grossetête says there are measures in place to avoid medical tourism.
On pourra refuser si par hasard il y a soit un problème dans le pays dans lequel ce citoyen veut se faire soigner, un problème d'épidémie, de contagion momentanée et donc un risque pour lui, ou bien alors si effectivement il s'avère que l'hôpital, l'établissement où il veut se faire soigner n'a pas la réputation nécessaire de qualité des soins. La directive répond aussi à la question du tourisme médical. Cela veut dire que lorsque vous êtes remboursé de vos soins que vous avez obtenus dans un autre pays que le vôtre, eh bien, si par hasard l'opération ou les soins sont plus élevés, ont un coût plus important que les mêmes soins donnés dans votre pays d'origine, vous ne serez remboursé que sur l'équivalent de ce que vous auriez touché dans votre pays d'origine. S'il y a une différence, un coût supplémentaire, c'est le patient qui va devoir payer ce coût supplémentaire.
Unless a treaty change says otherwise, a common healthcare plan in Europe is not on the cards in the near future. However, that certainly doesn't mean that the EU's role in this field has gone as far as it can. So what lies ahead for the future of Europe's healthcare? Like most of the EU's portfolios, the health sector faces the age-old problem of bad press, where citizens are just not aware of what the EU is doing. So Madame Grossetête is now working on an ambitious programme for 2014 to 2020, Health and Growth for Citizens, in which she says health must be seen as an investment for all, a lever for growth and jobs in times of crisis, with more innovation and research to create new products and better resistance to antibiotics.
D'ici 2030, j'imagine qu'on va assister au développement d'une nouvelle médecine. Jusqu'à présent, la médecine, c'était une médecine qui venait d'en haut, on sort un médicament qui est fait pour tout le monde. Avec la médecine personnalisée, on peut se dire qu'on va avoir une médecine véritablement adaptée à chaque individu. Et ça, c'est fondamental. C'est lié à la recherche sur les biotechnologies.
In view of our increasing ageing population, she is also putting greater focus on preventing age-related sicknesses such as dementia, which has health, economic and social consequences for all members of society. Another goal is to implement a cross-border electronic healthcare system, which will enable EU citizens to obtain e-prescriptions anywhere in Europe. So although healthcare remains a national competence, being a member of the European Union certainly offers its advantages when travelling abroad and the increased choice of treatment available. Healthcare in Europe has progressed a long way in a relatively short period of time, and according to our experts, it will continue to offer its citizens even more in the years to come. Thank you for watching today, and join us again soon for more EPP success stories.